Hi everyone, this is Dr. Heather Austin Robillard, and today's lecture is going to go over prevention planning, and we will specifically be focusing on the Strategic Prevention Framework, which is recognized by SAMHSA. Over the course of this lecture, you will learn about the general components of the Strategic Prevention Framework. We will go over in depth the 5-step process of the SPF model, some specific guiding principles of SPF, and then the specific features that characterize the Strategic Prevention Framework. The Strategic Prevention Framework is a 5-step process to developing a prevention program in a community. The 5-step process includes assessing the prevention needs in a community, building the capacity for prevention in a community, planning the program, implementing the prevention program in your community, and evaluating the goals and outcomes of this prevention program. Throughout the entire 5-step process, you also need to be adhering to sustainability and cultural competence. We will talk more about these at the end of the lecture. The first step in this SPF process is assessing the prevention needs in your community. In order to do this, we need to build a coalition. This is to establish and maintain a partnership with several community members with the same desired goal of prevention. Once you've built this coalition, then you can start assessing, and this happens in 3 different elements. First is identifying and understanding the population's needs. Then you need to determine the availability and necessary resources needed for these prevention needs, and assess the community's readiness for change. When you assess the community's readiness for change, you determine which of the 9 categories it falls into. This can range from no awareness or possible tolerance for substance use in the community, denial of a substance use issue, vague awareness around the problems, a pre-planning stage of beginning to implement, preparation, initiation, stabilization of the problems in the community, confirmation and expansion, and professionalization. The higher stage of community readiness, the more availability of prevention programs are in the community. This phase is important because it helps you develop a framework or model of change in your community. The next step is building capacity. In this step, you're focused on building the community's ability to engage in prevention efforts. Capacity building involves mobilizing human, organizational, and financial resources to meet your project's goals. Training and education to promote the readiness in the community are also critical aspects of building capacity. The Substance Abuse Mental Health Association, or SAMHSA, provides extensive training and technical assistance to fill readiness gaps and facilitate the adoption of science-based prevention programs in a community. It is important in this phase to increase participation and membership, build leadership, enhance cultural competence, and improve organizational management and development. Step 3 is the actual planning phase. This phase involves creation of a comprehensive plan that includes goals, objectives, and strategies that are aimed at meeting substance abuse prevention needs within your community. It is why assessing for the needs and problems in your community is the important first part of this phase. During this phase, organizations select logical models and evidence-based policies and programs. They also determine the costs and revenues needed for an effective prevention implementation. Step 4 is the implementation stage. The implementation phase of the SPF model is focused on carrying out various components of the prevention plan, include developing interventions, influencing policy development, advocating for change, and writing grant applications for funding. It is also important in this stage to identify and overcome any barriers that might prevent implementation from being successful. Organizations should detail the evidence-based policies and practices that are needed, develop specific timelines, and decide on ongoing program evaluation needs. Some of the things we need to consider when we're implementing a prevention program include recognizing that there might be a need to change interventions that committees have selected. They may be working with a target population that is different from the population originally evaluated for this program, or they may need to change certain program elements due to budget, time, or staffing. In these cases, practitioners may adapt the program to meet local circumstances. But you also need to balance fidelity and adaptation, which can be tricky because any time that you change an intervention, you may also be compromising the outcomes. So you can't just change something because you don't have funding without recognizing whether it changes the outcomes of your program. Even so, implementing a program that requires some adaptation may be more efficient and cost-effective than redesigning an entire program. Here are some of the general guidelines for when you need to adapt an intervention for your prevention program. First, you want to try to select the program with the best initial fit to your local needs and your population's conditions. This will reduce the likelihood that you will need to make adaptations in the future. So prevention for your prevention program. Then you will want, if that doesn't work out, then try to make sure you're selecting programs with the largest effect size. Effect size refers to the magnitude of the effects of an intervention. So how many people will it impact? This is important because policy change interventions generally have a larger effect size than those with classroom-based interventions. Also, the smaller the intervention's effect size, the more careful you're going to want to be when changing any type of intervention because you don't want to inadvertently compromise any good that you're doing already. In general, adaptations to programs with large effect sizes are less likely to affect relevant outcomes. Also, make sure that you're changing capacity before you're changing program. It may be easier to change your program, but changing the local capacity to deliver it as it was designed is a safer choice. Make sure you're consulting with experts, including the program developer and an environmental strategist or your evaluator. They may be able to tell you how the intervention has been adapted in the past and how these adaptations will work out in your program. A greater likelihood of effectiveness when a program retains the core components of the original intervention. Adhere to evidence-based principles. Programs and practices that adhere to evidence-based principles are more likely to be effective, so it's important for these adaptations to be consistent with science. Another important tip is to add rather than subtract. Doing this will decrease the likelihood that you're eliminating program elements that are important and effective. Then lastly, effective cultural adaptation is very important. Cultural adaptation refers to program modifications that are culturally sensitive and tailored to a particular type of group. Effective cultural adaptations consider values, attitudes, and beliefs and experiences of a target audience. Also within the implementation phase, you'll want to consider developing an action plan. An action plan is a written document that lays out exactly how you will implement a selected program. It describes what you expect to accomplish within this program, what are the specific steps you need to take to get there, who will be responsible for which part. It needs to include a timeline, and an action plan helps to ensure that everyone involved in the prevention effort is on the same page. If you are implementing more than one prevention strategy, it might be helpful to develop an action plan for each strategy. Step 5 is evaluation, a very important phase in the SPF model. The evaluation phase focuses on evaluating initiatives and sustainability of a project. Evaluation helps organizations recognize what have they done well and what are the areas that need improvement in this prevention program. The process of evaluation includes measuring impacts of the program and practices to understand effectiveness and need for change. Evaluation efforts greatly influence future planning of a program. It can also impact sustainability because it can show sponsors that their resources are being used wisely. Even though it is listed as the last phase, it is something that should be attended throughout your prevention planning process, so you're not waiting to the end to implement specific evaluation strategies. There are two guiding principles in the SPF model: sustainability and cultural competency. Sustainability refers to the process through which the prevention system becomes a norm and it is integrated into ongoing operations. Sustainability is vital and ensures that the prevention values and processes are formally established, that partnerships are strengthened, and the resources are secured over time. Cultural competence is the process of communicating with audiences from diverse geographic, ethnic, racial, and cultural backgrounds. Becoming culturally competent is a dynamic process that involves cultural knowledge and skill development at all service level works, including policymaking, administration, and practice. What are the distinct features of the SPF model that separate it from other program planning strategies? Well, it requires it to be data-driven. That data should guide all prevention decisions. The data helps identify problems to address, the best ways to approach the problems, and determining if the community is making progress in their prevention needs. It also needs to be dynamic in that practitioners may have to go back to earlier steps in the process. It is a circular process rather than a linear process. The prevention program also needs to be focused on changing the population and not just the individual. This is why multiple strategies in the prevention program are needed to address as many risk factors and protective factors as possible. Prevention planning should focus on all ages, not just adolescents, which was the traditional view. It should be focused on those target areas that don't get much attention, like ages 18 to 25 or 65 and older. Each step requires and benefits from the diverse community partnerships, so it needs to be reliant on a team approach. The need for prevention partnership is needed throughout the process and is why coalition building is so important. Here is a diagram that shows the important factors of each step in the strategic planning framework. This will be important as you develop and plan your own prevention. As you can see, each of the phases is broken down into the specific strategies that is needed to accomplish that stage. And at any time throughout your prevention process, you may go back to an earlier stage to adhere to specific steps.